Hello, hello. Good evening, everyone. Welcome back to our show. So glad that you're here. Hopefully you had a good Monday and a good weekend. Mother's Day weekend was just this past weekend. So welcome. This is Dr. Dwayne Woode. That's Woode with an E, and the E stands for endocrinology. Here on this channel, I help to educate you, help to empower you, and encourage you to take charge of your health and your life, avoid complications, and live that healthy, fulfilling life going to the next level. Thank you for joining us tonight. We have an exciting show tonight. We're talking about diabetes, how to simplify your diabetes treatment. And if you saw the tagline that came out, you'll see treat your diabetes while improving your lifestyle. Treat your diabetes while improving your lifestyle. So we're going to put those together and see how we go through the night. So glad that you're here. Welcome. If you are out there, we are glad that you're here. If you are new, please go ahead and put new in the comments so that we will know that you are here with us. We'd love to welcome our folks to the show. Also, if you have a question, as we get through the night, if you would put that into the comments, so we'll know that that's one that I need to grab so that I can pull it up. And I put in the comments there how that question should look. So Q in front of the question. So glad that you're here. Like I said earlier, Mother's Day was just yesterday. And so hopefully you guys had a good day. And to all our moms, thank you so much for all that you do for us. We could not do what we do without you. So thanks for that. We are excited because we are in the month of May. And as you know, May is Mental Health Awareness Month. And last week we had our guest with us, Mr. Choya Wise. And if you've not already done so, go back and take a look at that show, Mental Health Matters. It was a very good discussion that we had with him. So glad that you're here. Also, if you've not already done so, go ahead and find us on our various social media platforms. You'll see there LinkedIn, TikTok, Twitter. Instagram is not there, but it's the same thing. Dwayne Woode MD on Instagram, and you get to see some of the other things that we are doing and in our social space. So glad that you're with us. So diabetes, right? So diabetes is one of those things that continues to come up. And we know the numbers, 422 million people around the world that suffer from diabetes. And in the United States alone, 37 million people, that's an updated statistic of people suffer with diabetes. And as we think about the treatment of diabetes, one of the interesting things that we find is that there are about 22% of patients, that's 22% of patients who are not at their goal of below 7, actually. I was going to say 6.5, depending on which organization you talk to. So 6.5 or below 7. So 22% are there. And then if we think about all of the goals that we have for our diabetics, right? So remember the ABCs, and we did a show about A1C and diabetes, the ABCs, right? So if a person is not at goal for all of those, and we combine all those people, we're averaging about 30%, right? So despite all the things that we're doing for diabetics, we're still finding that people are not at goal. We continue to have an increase in the number of people that are suffering from diabetes. And certainly we're having an increase in the number of people that we're seeing that have pre-diabetes, right? So that's a huge number. I think 88 million the last time I looked, and that may have been updated recently as well. So 88 million people in the United States alone that are that are pre-diabetic. So it is a huge issue, right? And because of all of because of all of the noise, I guess we hear, there has been some confusion in the public about what diabetes is, how to manage diabetes, and the things that are beneficial. And that is unfortunate, because I don't think anybody disagrees about what the cause of diabetes is. What we probably disagree with is what is the best treatment, and how we should go about making that treatment. And as a result of the noise, as I call it, all the stakeholders, very well-intentioned people, have conversations that sometimes sound as if they are not shooting for the same thing, right? And we'll talk about what our goal is here in a minute, as we define what we're gonna ultimately want to happen. And so what I see in the space is that there are these two groups of people that have developed what I call the eat right people, right, and then the treat people. So the eat right people said, just if we can get everybody to eat right, then all of our problems go away. And then the treat people, or treat right people, say, okay, no, let's just treat the blood sugar. Okay. And I think because of the words and the tone and some of the things that they talk about, everybody gets the opinion that these people are on opposite sides of the fence. And the actuality is, if you talk to them, all of them have the same goal for our population, for our people, for our patients, for our clients, for those that are around the world. And tonight we're going to spend some time talking about those two views, and also talking about where we need to be. All right. So before we get into all of that, let's talk about what is our goal when we're talking about the management of diabetes. And in that actuality, when we're talking about the management of diabetes, pre-diabetes, we can even throw obesity in there, right? Because that comes in, metabolic syndrome, all those things. But the goal for us is, how do we get patients to live as long as possible and be as healthy as possible? Remember, those are the two things. How do we get them to live as long as possible and be as healthy as possible? That's our goal. And when it comes to diabetes, there seems to be a misunderstanding of what diabetes really is. So let's talk a little bit about that. So the argument goes, or the discussion goes, is it an insulin problem, or is it a sugar problem? Is it an insulin problem, or is it a sugar problem? Well, as we have the discussion, let's go through each of them. Right? Let's go through each of them. So number one, let's start talking about sugar, right? Because everybody knows sugar. Insulin is a little bit more nebulous, if you will, but we'll get to that in a minute. And to kind of talk about blood sugar, I want to even use a simpler analogy. I want to talk about cars, right? Yeah, cars. And I have to admit, these are one of the old cars, right? So you know the car where I used to be able to get in there and actually see the stuff, and maybe I could take a carburetor out or whatever, right? So the new cars, I don't know anything about them, right? But we used to live in Ohio, and my car was outside a lot of the time. And so I'd come out in the morning and I'd turn the key, right? So it make that sound, and it wouldn't start. And I take my foot and I pump the gas a couple of times, and the car would start up. Imagine what would happen, if you know anything about cars, if I pumped the gas one too many times, right? I'm putting more gas into the system. And what happens is I flood the carburetor, right? And so the car had all of this energy, gas in it. It has a battery that's working, right? Everything else is working, but it would not run because the carburetor is flooded. Let's go through that again, right? So the energy is in the car. It's full of gas. There's a battery that's working. Everything else in the car is functioning normally, but it does not run because I flooded the carburetor. And what I had to do is basically wait. All right. Now you could try lots of different things. You know, people would blow it out, or, you know, all kinds of not new, but all kinds of little tricks that you have. But ultimately, the carburetor had to dry out before the car would run. Let's come back to the body. So the body is full of quote unquote energy, right? Sugar, glucose is running around the body. We won't talk about how it got there. And, you know, that's a whole, we did a show on that. You can go back and look at one of our shows, and we'll put that in the description below. But your body is full of sugar, and it does not function well because it's flooded. That's right. There's too much sugar in the system, right? The blood sugar itself right now is toxic to the body. High blood sugars. The body doesn't like it. It damages the body. That's why we talk about all of the opathies, right? Triopathy. So the retinopathy, the neuropathy, the nephropathy, right? So the eyes, the kidneys, the feet, right? All of those things happen because of high blood sugars, because it damages. High blood sugars damages cells. They damage cells. So there's no misunderstanding. There's no argument. There's no confusion, if you will, about the fact that high blood sugars damage cells. And we want to get blood sugars down. Everybody agrees about that. How we get it down, we'll talk about it in a minute. So that's the sugar part. We know that it's damaged, or it is damaging. And so all the studies have said, if we can lower the blood sugar, we can decrease the complications of diabetes, particularly high blood sugars. But here's the question. Why are the blood sugars high? And this is where the insulin comes in. Remember, insulin is the thing that helps to manage sugar. And the way the body works in a person who's diabetic is that they are unable to utilize the insulin that they have effectively to keep the blood sugar within the target range. And target range, whatever that target may be. Either the insulin is ineffective or not enough. Initially, it starts out by being ineffective. And when I say ineffective, that's the whole idea of insulin resistance. So there are changes that happen in the body. And so the amount of insulin that the body makes has to increase to be able to keep the blood sugars at a certain level. That is what insulin resistance is. We want to get into the mechanism of how that works and why that happens. Once again, we did a show on that before. Right? So there are these two things. There's the blood sugar that is damaging to the body, and we believe that it's caused by insulin resistance. Now, a question that everybody watching or if you're there right now watching on the replay, will ask is, well, why did the insulin go up in the first place? And we believe that the insulin went up for multiple reasons. One of the reasons is going back to the sugar, right? So the high sugar causes, remember we talked about flooding the system? The high sugar causes, higher sugar causes the body to produce more and more insulin. The other thing is we believe that there are inflammatory processes that are going on in the system. Those inflammatory processes make it more difficult for the amount of insulin that we have to lower the blood sugar, to keep them in range. We believe there's a weight component, right? So the more weight we put on, the more insulin resistant we become. We think there are inflammatory markers, inflammatory substances in the adipose tissues that we have. We believe that there are hormonally induced issues with blood sugar and insulin resistance. Some medications that you may take, some disease processes that you may have. All of those things can lead to insulin resistance. And insulin resistance, once again, is ineffective insulin in the system. And because those things are there, right? So now we have these two components that seemingly fight against each other, right? Whether we treat the sugar or whether we treat the insulin. And I'm going to propose here in a minute that we don't have to make a choice. See, I gave away, right? I gave it away. We don't have to make a choice. So once again, we're our goal with the sugar part is not to flood the system. Our goal with the insulin part is to bring the insulin down. Okay? And it would seem often that these are two divergent issues. But there are two conversations that we have to have, and I don't think we should have the conversations together. I think at some point the conversations have to combine, but I don't think we should have them together. Okay? So let's talk about the insulin part first. Everybody understands. You can't talk to a single person, I think, that doesn't understand that eating well, controlling the diet, can help decrease insulin. And particularly when we talk about eating well, right, one of the big things that everybody talks about is carbohydrates. Once again, don't flood the system. Don't flood the carburetor. So if we are going to work on decreasing the amount of insulin that the body is making, one of the best ways to do that is not put so much stuff in that's causing the insulin to go up. And where does that come from? A big part of it is from the diet. Right? The refined foods that we eat. The high carb content in stuff that we eat. Now, if we think back to, can't even give you a time frame, but if we think back to our history, the way that our body knew that we were full was because we put food in it and the stomach stretched. And that stretching mechanism, right, sent a signal to the brain that says, hey, it's full down there, so don't put anything else in. Our food has become so dense now that we can get the same amount of calories, the same amount of carbs in something that's about this big, right? As something years ago that took a lot of space in our stomach. So our food is a little different. We're eating a lot more carbs, and there's a whole conversation we can have about that. Years ago, some of the things that we have ready access to now, we didn't have on a continual basis, right? You ate the things when they were in season. But now we can ship things all over the place. Well, not with the supply chain thing that's going on now, right? But that's a consequence of COVID and so forth. But prior to that, I could be here in Alabama and have some fruit that doesn't even grow here that came from South America. And I can have it all the time. Right? I could run out down the street here. Right? There's a Wendy's, there's a McDonald's, there's a Jack's, what else is out there? A Subway, there's a bunch of, some Chinese restaurants. Right? Lots of access. And a lot of it has to do with carbohydrates. Now, I'm not demonizing carbohydrates, right? Because we use carbs. And carbs, we put them in and they get converted to energy. That's what the body uses. But once again, don't flood the system. Don't flood the system. That's our goal. So eating well, certainly, right, is one of the things. Exercising, right? Let's go back to our car analogy, right? So I fill my car up, I don't know, maybe every 4 or 5 days, maybe 6, right? Depending on how low I can let it go. Right? So why do I have to fill the car up? Because I'm using the gas. I'm using the energy, right? So how do we burn that sugar that's in our system? What's that called in people terms? That's called exercising, right? So that's another way of doing it, right? So number one, let's not put so many carbs in. Number two, there's exercise. We burn it up. 30 minutes a day, 7 days a week is what we recommend. Because the more you move a muscle, the more carbs are burned. Because that's what the body does. It burns carbs for energy. And anything that's left is stored. We'll come to that in just a minute, right? So if you put in more stuff, right, the body's burning, but anything else that doesn't get burned, guess where it goes, right? It goes into the pantry of the body, right? Just like at your house. If you bring some stuff at the house, you cook what you need, you put that in the refrigerator, everything else goes into the pantry until you need it. Then you take it out. You know what the pantry of the body is called? It's called fat cells. Adipose tissue. And so if you are not burning it, then the body stores it. The body stores it. And then it gives it back to you when you need it. The average person it uses about 1,600 to 2,000, depending on your activity level, calories per day. 1,600 to 2,000 calories per day is what we use. 1 pound of fat, 1 pound of stored fat has on average about 3,000 calories, right? So people say up to 3,500. So theoretically, if I have 1 pound of fat stored, I can go about 1 day without eating. 1 pound of fat, I can go 1 day without eating. A little bit more. So that means then if I have 10 pounds of fat that's stored, I can go about 10 days without eating. And during those 10 days, here's the kicker. Even though I didn't eat anything, I can still have a high blood sugar. Yeah, isn't that amazing? Right, because the body has energy already there and it gives it back to me. So exercise. Number 3, which is very much underrated, is water, drinking water. Right? Have you ever made iced tea or sweet tea or lemonade or Kool-Aid? What happens if you put too much water in whatever you're making? It gets diluted. So we can think of our body like this big pitcher of Kool-Aid, right, with sugar in it. The more water we put in, guess what? The more dilute the sugar gets. All right? So that's lifestyle. And there are a bunch of other things, and we've talked about those here on this channel. We've talked about getting sleep, right? Because if we don't get enough sleep, guess what? Blood sugars are higher. If we're stressed, blood sugars are higher. If we're in pain, blood sugars are higher. I mean, just a whole host of things. So managing all those things have to do with lifestyle. That's the lifestyle part. Right? That's the eat right group. Lifestyle. And all of those things are beneficial. All of those things work. All of those things are the things that we tell our patients. All of those things are things that we encourage and we review with, and we come up with structures and routines and morning routines we talked about, right? Because those are the things that we want to do to have long-lasting effects. Because ultimately our bodies are there to protect us. Right? And if we do the right thing, if we treat it the way it was designed, if we treat it with the things that it needs, then the body, it's an amazing machine. So all of those lifestyle things are things that we tell people, yeah, you gotta do that. You gotta exercise. You gotta eat right. You gotta do all that stuff, right? And all of those things that I just mentioned help to lower insulin. Now, a lot of them help to lower sugar as well, but help to lower the insulin. Because we said that ultimately that's the pathology behind diabetes. That the insulin doesn't work well, and so the blood sugars elevate. Right? Yeah, I love that. I love that discussion. A lot of other things that we could talk about there, but you know. So in the comments, I want you to say yes or no, right? The stuff that we just said, the stuff that we just talked about, is that stuff that resonates with you? Is that stuff that you've heard, stuff that you believe in? Yes or no in the comments if you're out there. And let's see who's there. So we've got Dr. Charmaine. She said, finally able to join. Good evening. Oh, that's Lauren. Sorry, let me go back up for a minute. So hi, Lauren. Welcome. I'm glad that you're here. She says late joining, but good evening, everyone. And then we see Dr. Charmaine Woode that's on. She's saying good evening as well. Awesome. All right. Yeah. So if this is stuff that you've heard, stuff that resonates with you, go ahead and put a yes in the comment. Okay. That you've heard it. Somebody said these things for you. You've heard some of this information before about lifestyle changes. Awesome. All right. So let's pivot for a minute and let's talk. So now we've talked about the lifestyle, right? And that's the eat right group. So now let's talk about the treat right group. And the treat right group, I think a couple of things have happened. Number one, I want you to understand that, and let me be cautious as I say this, right? I want you to understand that when our physicians are treating patients, what we're doing is we're treating the disease process that we see in front of us. I want you to understand that. Okay? Now, so someone right now at this moment has a urinary tract infection, and I'm treating the urinary tract infection. At that moment, I'm not trying to figure out what caused the urinary tract infection. Someone is bleeding right now. I'm trying to fix the bleed right now. Someone's blood pressure is dropping. I'm trying to fix the blood pressure. Someone's having a stroke. I'm trying to halt the stroke. They're having a heart attack or have had a heart attack. I'm trying to treat the heart attack. We're going to figure out, we're going to find out, right? Either me, the treating physician, or someone else is going to figure out that, oh, you know what? This person has some problem with their urinary retention, or they're taking a medication that's causing them to spill sugar in their urine, or they're taking some blood pressure medicine that's causing their blood pressure to drop, and we're going to stop the blood pressure medicine. We're going to treat the medication or stop the medication that's causing urinary tract infection, or, the bleed, right? We're going to stop the bleed. But right now, my job is to treat this patient right now. Make sense? All right. So that's with the backdrop. So that when a patient shows up with a blood sugar of 400 or an A1C of 12 or whatever the A1C is, the goal at that moment is immediate treatment of the blood sugar. We can teach you how to eat tomorrow. A lot of times we do it the same day, right? We send them to education. But right now, my goal is, how do I get this blood sugar down? And so the goal at that moment is, I need to treat this blood sugar, this A1C, because right now we said that the high blood sugar is damaging to the cells. So when someone shows up in the emergency department and they're in DKA, that's diabetic ketoacidosis, right? Extreme form of high blood sugar. At that moment, right? What is my goal? My goal is to get them treated, get the blood sugar under control. If I have someone who comes in who's a type 2 that has a hyperosmolar state, which is a really high blood sugar, but they're not in DKA, my goal is to get the blood sugar down at that moment. So when they walk in the ER, guess what, guys? I'm not talking to them about eating right. I'm not talking to them about exercising. That will come. But at this moment, my goal is to treat. And so the treating of high blood sugars, let's talk about that. How do you treat high blood sugars? Now, here is where the two begin to meet. The two conversations begin to meet, right? Because every patient at a moment can make a decision on how to treat blood sugars, because there are only a few ways to treat blood sugars, right? Number one, they can eat less of what causes the blood sugar to go up. Whoa, wait a minute. Doesn't that sound like lifestyle? It does. So if you're eating a cookie and you normally eat 5 cookies, guess what? Eat 2. That's right. I said eat 2 because it's less than 5. For those of you who are watching, it's less than 5, right? So eat 2. Is the blood sugar still going to go up? Yes, it is. But it won't go up as high as if you ate the 5 cookies, and it won't stay up as long. Is that improvement? Yes, it is. Exercise. People say, well, I already exercised this morning. Well, did you exercise for the cookie that you're about to eat? Right? And if you didn't, then guess what? Exercise. And you ate the cookie and you exercised and the blood sugar is good. And 2 o'clock in the morning, you wake up again and you eat another cookie. Guess what you can do? Exercise again. But you already exercised last night and you exercised yesterday morning. Yeah, but you're now eating another cookie or you're drinking some juice. The treatment for the sugar, the treatment for the food, the treatment for what you're eating has to correspond at the time of food. So you can't exercise this morning and then eat a big bowl of pasta because you say, oh, I exercised this morning. No, you got to exercise right now. And did you exercise enough? That's a novel one, right? So if you ate a bowl of pasta and you exercise and the blood sugar is still 500, guess what? The exercise didn't work. You need more. Because the food has to match the treatment. Food has to match the treatment. Drinking water. Yes, water will lower the blood sugar. How much water should I drink? I don't know. How many carbs are you eating? And say, well, that water is not just going to bring it down. Well, you got to pair the water with something else like exercise and eating less of the carbs. So both those things, right, can happen. And then here's guys. So if you're exercising, if you're eating, less and you're drinking the water, until you learn the lifestyle part. Let me say that again. Until you learn the lifestyle part, you need medication. That's right, I said it. Right? Because it's one of the tools. Because our goal is to keep you alive as long as possible and to help you be as healthy as possible. So until you learn how to change your lifestyle, guess what we have left? That's right. Medication. And that's the beauty of this. The beauty of it is that we get to merge those two together. That we say, while we treat your diabetes, let's learn how to change our lifestyle. While we get the blood sugars down, let's also learn how to decrease the insulin. While we deal with the consequence, let's also deal with the pathology. Amazing. But sometimes we cannot have the conversations together. So when we bring patients into the office, we have the conversation with them about let's treat the blood sugar. Let's stop the bleeding. Let's stop the heart attack. Let's stop the stroke. Let's stop, right? Let's plug the hole right now. And then now, let's work on this other part. Because do you know how tough it is sometimes to take someone who's been eating a certain way all of their life and then tell them, okay, next week, you got to change that. How long has it taken you to break a habit? How long has it taken you to change a behavior? It's the same thing. So while we're working on the lifestyle, treat the diabetes because it's causing damage. While you're learning how to eat well, while you're working on your exercise program, while you're working on drinking water and sleeping and dealing with your pain and dealing with your depression and dealing with all those things, treat the blood sugars. Because if we don't, the damage is being done. If we don't get to our goal of helping people to live as long as possible and to be as healthy as possible. We have to have the conversations come together. They can't keep diverging, right? Because our patients, our clients, everybody, we're getting confused. They're getting mixed messages. And they think that there are these two camps that are enemies, but they're not. They work in concert, and we have to work in concert. All right, this is a good place for us. So let's see if we have, let's see. Who do we have out here now? I'm scrolling back. Looks like we got a bunch of folks joining us. Let's see. So Florence, hey Florence, she said, good evening, everyone. Glad that you are here. Glad that you made it. Shanna said, yes. Hi, Dr. Woode. I definitely need to drink more water. For sure. I think we all do. We all do, Shanna. Thank you. And then Lauren says, yes, I heard it, but I believe all of us need these reminders. I love it. Love it. And Shanna is agreeing with Lauren. She said, definitely agree. And then Dr. Charmaine says, yes, she lives these. For sure. Glad that you're here. Hi, Shanna. Thanks for coming. Hello, Florence. So Dr. Charmaine is just kind of going through and talking to everybody. So she says, so in most cases, treat right takes priority over eat right at the point of care. That's a good point. Good question. Dr. Charmaine. So let me kind of walk you guys through briefly a visit. Okay, just quickly. So a lot of times patients show up in my office after they've had a difficult time getting good blood sugar control. Okay, so I see the patients who have tried stuff, they've been where they are for years sometimes, and their doc says to them, hey, we've done all that we can. Let's send you to see the endocrinologist, me. So the patient shows up and there are several things that are going on. Number one, a lot of times they don't want to be there, right? Because it's almost like getting sent to the principal's office, right? I don't think of myself as that. And I think I'm a pretty jovial, pretty kind guy, right? But sometimes patients come and they're apprehensive. Because maybe their doc has said to them before, if we can't get this down, we're going to send you to the endocrinologist. And now they haven't gotten it down. And here they are. And so they expect to walk into the room and I've got a big stick or something. The other thing that happens is that those patients have been trying for a long time to get their blood sugars under control. So when they show up, they may have wanted to come, but they are not fully convinced that anybody can help them. Because they've not had success, or they've had some success, some partial success, and they quote unquote fell off the wagon, as they say, which is a phrase I don't like, but it's one that we use. And when we say that, what it means is usually that we're not really doing the things that we said we were going to do or were told to do. And so we think, and people will use this phrase, oh, I'm a bad diabetic. Because I'll say to them, hey, what brings you to see me today? What can I do for you? And they'll say, oh man, I'm such a bad diabetic. Yeah. I'm a bad diabetic. So sometimes when I'm sitting in that room on that first visit, the first visit is wading through and breaking down all of those things that are going on in their heads. And the statistics tell us that if we cannot get someone controlled within that first year, then the likelihood that they will become controlled goes down. So think about this for a minute, right? So you're at your doctor, you're a diabetic, and you guys have not been successful in getting your blood sugars where they need to be. And the doctor says, hey, you know what? I'm going to send you to see the expert. I'm going to send you to see the endocrinologist. And you show up in my office. And you come in, we have a conversation, we decide what we're going to do, and it takes you another 6, 7, 8, 9, 10, 12 months. And you still don't have control. Then you say, well, I guess even the expert can't do this. So I guess I'm a lost cause. So a lot of diabetics end up being depressed. So the very first visit is, hey, we're getting this blood sugar under control. Okay. Yeah, we're going to teach you, right? And we do I mean, nope, not to pat myself on the back, but I think we do a very good job of educating patients on lifestyle things, right? So we have educators, we send them to education, we spend time in the room with them. When they come back, we're talking about exercise and sleeping. We're going through all of that. But it is paired with, we got to get this blood sugar down. And we talk to them about how and what is our mechanism for now coming off some of that medication, right? Because a lot of people think once they get on medication, that's it. They said, once I get on insulin, okay, my mom told me or my cousin told me or my brother told me that once you get on insulin, that's it. So they believe it's a death sentence. And I'm here to tell you that that's not true. So sometimes, to answer you, Dr. Charmaine, yes. Yes, okay. So let's see. We got Dr. Audwin Nelson. Hey, how are you? Sounds like the Paul Harvey of diabetes. Hey, Dr. Nelson, glad that you're here, man. Glad that you're here. Hey guys, give a shout out there to Dr. Nelson. Thank him for joining us tonight. So let's kind of step back for a minute, okay? And you saw both of the, let me see if I can pull both of them up for a minute. So this one, treatment, okay? And then this one, treat your diabetes while improving your lifestyle. So both of those, right, were the title as I was thinking about, okay, what are we going to talk about tonight? And I thought both of those were apropos because we've got to treat the blood sugar while we improve the lifestyle. I'm gonna tell you a little bit about me. Okay. I have type 2 diabetes. And sometimes I'm sitting in a room and listening to the patient, whatever they're talking about. And I said, yeah, that's exactly what it's like. That's exactly how I feel. That's exactly. Right? Because they say that phrase, I fell off the wagon. I fell off the wagon. I fell off the wagon. I fell off the bandwagon. And the reason I don't like that phrase is because of this. When I think of that, I think about, and I like, my dad used to like Western movies. And so I like them, Gunsmoke, and I watch some of those things. But I imagine, there's a little kid on the back of one of these chuck wagons going across this country and they hit a bump. And the kid falls off. And nobody on the wagon knows that he fell off. And for the rest of the movie, you see the kid running behind the wagon trying to get back on. Right? Because we've told people that that's how it is. You've just got to catch up however you want to, however you can. And we don't provide them with the structure on how to do it. So as I talk about combining these two conversations, it is, hey, let's treat your blood sugars, however we do that. But also now let's do a better job of teaching you what we need to do. And the teaching part, guys, that's hard. Oh yeah. Right? Because we're retraining our minds. We're retraining our taste buds. We're retraining our behavior. And a lot of times it has so many layers, right? That chocolate bar that you ate, you didn't just eat it, right? You didn't just eat it. You ate it for a reason. Because you were stressed or something's going on in the family or you were tired or you were in pain, whatever it was. So sometimes we've got to treat that first before we talk to you about the chocolate bar. Yeah. So there are all these layers that we've got to get through as we're dealing with people in the lifestyle arena. So it doesn't happen overnight. We've got to do it. We've got to have it, because that's where we get the long-term, long-lasting effects. But we got to do the immediate treatment. Does that make sense to everybody? I hope so. I hope so. Awesome. All right. So, I've been talking so much that I had that I missed doing our little station breaks. Let's do that real quick. So guys, if you've not done so already, please go ahead and check us out on all of our social media platforms. You see those there on the screen. We've got LinkedIn, TikTok, of course, here on Monday nights at 7 at our show. We've got our Twitter, and of course, buy me a coffee if you'd like to support our show. Also, we'll talk about that in a minute as we get to our subscription service. What's not on there is our Instagram. And so we do have Instagram as well. And the Instagram is the same thing, Dwayne Woode MD, Dwayne Woode MD. And you get to see some other things that may not show up on the YouTube channel there. All right. We have our coaching program that we have launched. And you can see that by going to DwayneWoodeMD.com, DwayneWoodeMD.com, and you can sign up. There's actually you can get to meet me for 15 minutes and just chat. Hi, Dr. Woode, how you doing? Get to know me a little bit. That's a free service that's actually on our website, so you can go do that. If you are interested in our subscription services, and I encourage you to do that, we've got that starter pack once again, and that has the 15 minutes as well, but you get access to a lot of our other resources, show notes, and some new videos that I am putting together that will just show up in the subscription service. That's the first one, the starter pack. The learner pack, you get to hang out with me for about 30 minutes as we do a virtual assessment. And then finally, for the advanced, you actually get a 60-minute virtual coaching session with me, diabetes coaching, life coaching, any of those, and you get that for the advanced program there. Okay, so I encourage you guys to take advantage of that. And then, of course, on our show here, we love to talk and chat with you guys. So we love when you guys come by. All right, so I see Dr. Charmaine puts in there. She said, let me see if I can get my mouse over. Here we go. She says, great conversation. Sounds like the goal is to strike a balance. Yeah, so let's come back. Thank you, Dr. Charmaine. So what is the ultimate goal? Remember, our ultimate goal is to help people to live as long as possible and to be as healthy as possible. And in everything we do, there has to be a balance. So how do you simplify, right? That was that one slide. How do you simplify your diabetes treatment? Number one, understand that it is an insulin problem, but it's also a sugar issue. Understand that you have to learn how to change the lifestyle, but you also have to treat. They are not mutually exclusive. They actually are complementary. And when we can do that, we get amazing results. Because that's what happens when the lifestyle is where it needs to be and we've treated, right? So we can prevent the damage that can happen if we don't. Then we get to live a long time and we get to be as healthy as possible. Well, thank you guys for coming. I always appreciate it. Thank you for being here. Love your comments. If you've not already done so, go ahead and give us a thumbs up on this video. Share it with any family or friends who may be out there who's suffering from diabetes, people who may have struggled with their diabetes, and even people who are currently doing well with their diabetes, so that they understand the symbiotic relationship between these two areas. Okay. And then share it, send it out, like it, We appreciate you being here. We will see you at the next visit. This is Dr. Dwayne Woode. That's Woode with an E, which stands for endocrinology. We help to educate, empower, and to encourage you to take charge of your health, avoid complications, and live that healthy, fulfilling life going to the next level. Good night, everybody. Let's get some music and let's get on out of here.